Dept of Health now, it's urging South Africans to go for regular cancer screening and testing to ensure they detect the disease early. This as the department is holding its cancer awareness drive in Hursthill, Johannesburg. The Deputy Minister of Health, Dr. Newzroom, is also expected to join the cancer awareness outreach program. The outreach program is a collaboration with Pink Drive organization and forms part of the World Cancer Day commemorative activities. Let's speak to Tumaole Mohlaoli. He is covering events there for us. What are we seeing and hearing? Tumaole, good morning.
Very good morning, Dudu. What we are seeing is a lot of color and a lot of exhibits, a lot of stands from various organizations, including Lancet Laboratories, which would be very key in the testing process. Of course, they deal with blood testing. We see a lot of organizations, including, of course, Campaign for Cancer, as well as, of course, Capital Legacy, which is one of those organizations that is showing support here to try and assist, as well as USAID, which is also very involved in terms of not only cancer but other medical, medical supplies, as well as the medical practices. But we are also seeing here survivors themselves who have come to tell their story, to say that cancer is beatable and cancer is not necessarily a death sentence. In fact, I'm standing with a multiple cancer survivor right now, that is Reynolda Makuhle. Reynolda, multiple cancer survivor, you are living testimony to the fact that cancer is beatable. What is your message and why is it important to have this day today?
My message is don't be silent. If you see any familiar thing on your body, because it's very expensive to test for cancer, go to your local clinic or speak to someone if you're underage so that you may be referred to the nearest clinic. Further investigation will be done, and maybe if it's necessary, be referred to a primary care hospital where everything can be done. I'm standing here. I've survived cervical cancer, ovarian cancer, breast cancer. I'm currently on remission with colon cancer. I'm now a granny. I had cancer at the age of 40. I'm now a granny because I never thought that I'll have kids. But I'm still here. I'm a voice of cancer. I'm here to represent an organization again called Cancer Vive, which is a survivor-driven initiative. Annually, we go to different provinces on branded motorcycles and cars to celebrate life, create awareness, share our stories in a form of a show, telling people that it's possible to survive cancer. We also include Mama Lillian Dube in our midst, who's also a part of our team. So today we collaborated with Pink Drive, including with breast cancer, Chrisani Baragwana Breast Unit. We here in the community of Hursthill. All the types of screening are done here, and we're here to say to people who are scared, here we are. We can survive cancer. We've beat it. You can beat it. Don't be scared. If you have cancer, it's no more a big C. It's just a word. Early detection not just saves lives, it prolongs life. I'm a 24-year-old survivor at this present moment. I will not be silent. That's what we go and spreading around. We will not be silent. We use those words. Behind them are myths that are addressing cancer, that is not contagious. It doesn't make you a lesser person. Early detection saves lives. Anybody can have cancer. It's not a white or old person's disease. Those are the messages that we're spreading out there. And support, we're doing care session to cancer patients in all the provinces at hospital where we go. We give them gifts and hope to say, fight a good fight and rise above the board, above all odds. Thank you.
Very inspirational message there. And what about for the families and for the loved ones of those who are fighting the battle against cancer? What advice can you give them? What can they do to ensure that they give the best support to their loved ones?
My best advice is to please join a support group, because believe you me, I was in my cocoon for 4 years. I could not talk to anybody else because I'm a project of rejection and prejudice. I was rejected by the church, by the people that I love the most, but after 4 years, I was invited to a support group where stories were shared similar to mine, and I could see that my story was not an ordinary story. people were going through a hard time. So you as caregiver, as families, I know when we have cancer, I had cancer when my kids were very small. They suffered the most. It's very important as caregiver, attend support group so that you may know on how to handle us, especially if we are in the process of the treatment, which one of them is chemotherapy. Where we become moody, you don't know how to react. A support group will assist you to do that.
Thank you very much for that inspirational story. That was Renolda Makutle, who's a multiple cancer survivor. And just off the back of my shot here, I noticed that it seems as if the Department of Health officials have arrived. I have not caught sight of the Deputy Minister, Dr. Sibongiseni Dhlomo, but it does look like the delegation is here, and they are going about also engaging with various people at the stalls, the cancer survivors themselves, Pink Drive organization, to try and see what the department can do and has been doing, also to relay, to try and support those who are in the battle with cancer, and those who are survivors as well, and those who are getting treatment, are in remission. And this is a very important aspect of what the department would do, as Mepinki just said, that support is the way to do it, and again, an understanding for those with relatives who are fighting the battle against cancer, to be patient and to have that understanding, because the treatment is quite intensive, and therefore a lot of compassion is what's needed, along with love and along with understanding. But that is back to you in the studio.
In fact, Tumaole, we were speaking to a pediatric oncologist a little bit earlier on, speaking about how cancer impacts children and young people, and I see there's a number of them also behind you. Are you able to maybe give us a view of what you're seeing? The outcome looks healthy.
Yes, as what I'm seeing right now, right behind me, you could see that it is quite a nice mix of people here. And again, as Mepinki said, the idea is that the message should be spread not only to those suffering from the battle with cancer or battling the disease, but also to young people, to try and demystify cancer in communities, to say that it's not a death penalty, and young people should go out and actively seek to be screened at an early age and not see it as something of a stigma. And therefore you can see there you've got little youngsters here, you've got youths, and as well it's a nice mix, a nice generational mix in fact, and therefore this is the message that cancer is something that affects people from all walks of life, from all age groups, and this is something that should not be taboo. So this is definitely why you see this mix of people as I come back into shot there, and it's a message that the people here and the organizers are saying they want those who have come today to carry out into their communities, so that the issue of early detection specifically and screening is something that is prioritized along with all the other usual health checks that people undergo.
Today is World Cancer Day, and Tumaole Mohlaoli is out in Hursthill, Johannesburg, marking commemorations and awareness drives. Thank you very much, Tumaole. We'll touch base with you a little bit later on.